One major concern raised by the Ministry of Health, Wellness and Elderly Affairs is the devastating impact of measles, as on May 10, 2024, one case was recorded within the Caribbean. This realization has prompted health officials to enact a swift defense. Dr. Michelle Francois, national epidemiologist, empowers St. Lucians with an education campaign detailing the preventative measures locals can implement to reduce the chance of contracting this highly contagious disease.
It is spread very easily when an infected person talks, coughs, or sneezes. One infected individual can infect almost 90% of their close contacts. Being vaccinated is the best way to prevent getting sick with measles or spreading it to other people. According to the World Health Organization, prior to the introduction of the measles vaccine in 1963, there was an estimated 2.6 million deaths annually. The vaccine is considered a safe and effective method of helping your body fight off the virus. Between 2000 and 2022, an estimated 57 million measles deaths were avoided through the introduction of immunization activities targeting measles and rubella. During the COVID-19 pandemic, there was a notable disruption in both immunization programs and surveillance activities for vaccine-preventable diseases. As a result of this, in 2022, an estimated 136,000 people died from measles.
Dr. Francois details symptoms and warning signals that serve as indicators for anyone who has contracted the infectious disease.
Signs and symptoms of measles usually appear between 10 and 12 days after exposure to an infected individual. But in some individuals, it may take as many as 21 days to develop. Symptoms may be similar to that of the common cold and include fever, cough, runny nose, and conjunctivitis, also known as pink eye. People may also develop whitish spots in their mouths, followed by a rash, which starts on the face and spreads to the entire body. It is very important to note that an individual can spread measles even before the rash appears. In fact, the infection can spread up to 4 days before the rash appears and as many as 4 days after the rash develops. The virus remains active and contagious in the air or on infected surfaces for up to 2 hours. Anyone who is not immune to measles can therefore get infected with the virus.
The Ministry of Health protects St. Lucians with a dedicated effort, as an initiative has been launched in order to mitigate any potential spreads of the measles.
Teams from the Ministry of Health are on the ground in areas with low vaccination coverage to encourage and facilitate vaccination to those who have not been vaccinated or have missed doses of any vaccines. An adequate stock of vaccines is being maintained in the event of the introduction of a case of measles or any other vaccine-preventable disease. We recognize that a case of measles will most likely be introduced at one of our designated ports of entry. The Ministry of Health has recently completed standard operating procedures for the ports of entry and will be engaging all of our stakeholders to familiarize them to their roles and responsibilities, reporting mechanisms, and ways of detecting and protecting themselves and the public against infectious diseases. Surveillance is also being heightened to contain this threat. Training and sensitization for healthcare providers is ongoing. This includes reporting of all cases presenting with fever and rash, and case investigations will also be done on all such cases.
The Ministry of Health comprehends how essential the public is in assisting in early case detection for this disease and implores individuals to remain vigilant and report any suspected cases to the appropriate medical personnel. For Choice News Now, this is Obi Offor reporting.